Colleen is asking, is being on an aromatase inhibitor, potentially like a tamoxifen, put her at a higher risk of dementia or Alzheimer's? That's an excellent question, Colleen. I actually work with a ton of breast cancer patients and thrivers and survivors that are often on enzyme or estrogen blocking or hormone blocking medications after their initial cancer diagnosis. And so often we're seeing 5, 10, 15 years of taking these medications. And that's definitely a concern that I do want to address. I will let you know there has been some clinical analysis and research in a very large group of women. So we've looked at over 50,000 women in addressing, will taking a medication like tamoxifen to starve any potential cancer cells of reoccurring, does that set a woman up for dementia, Alzheimer's, or any type of brain-related health imbalances? And what research shows is that it's inconclusive. So that is kind of an interesting point there. Now, the other thing that research did show was that the women in the study, they had a lowered propensity of diagnoses with Alzheimer's and dementia. So I think what I recommend and will communicate to you here is that it depends on each person's case. And we all have genetic propensity or disposition to possibly have dementia or Alzheimer's occur in our body from looking at our family members, our mothers, our fathers, aunts and uncles, and even siblings. So with that being said, I always recommend supporting your brain health by doing several things. Our brain is comprised of fat and water. So you want to make sure you're consuming good, healthy fats on a daily basis to bolster the fat content of our brain. And you want to make sure you're not being dehydrated or in a dehydration state. Many individuals are not drinking enough fluids or liquids. If you consume coffee, you want to have the same amount of liquid, meaning water, mineral water, or good, healthy green juices. So you want to make sure you're getting hydrated properly. The other thing that I recommend that Organixx provides is Ageless Brain. This has 2 really amazing neuroprotective compounds in the ingredients, as well as a whole bunch of other benefits for supporting your brain health. But I want to zero in on camu and bacopa. Those 2 have been extensively studied. These 2 ingredients in Ageless Brain are amazing for helping your brain cells regenerate, rejuvenate, repair, and recover. And I have a lot of patients that have had chemotherapy or even radiation of the head and neck. And I always recommend neuroprotective and neuroregenerating supplementation. So Ageless Brain would be something I would recommend for you. Now, the other thing that's really important is to lower your inflammatory levels or inflammation that might be present in your body systemically, as well as in the blood and the brain. So I want to recommend one of my another favorites of mine here at Organixx is the Magi Complex. This is a trio. It's called the Trinity of Master Anti-Inflammatory Properties. And what you're going to get there is just an overall systemic lowering of inflammation levels with the 3D turmeric, which is a fermented turmeric. So you get the bioactive max benefits of the anti-inflammatory properties of turmeric. Turmeric also will invigorate the lymphatic system. And for any of my breast cancer patients, I want to make sure we're getting lymphatic flow, and especially when we've had breast cancer, radiation, and chemo, and even surgeries where we've had lymph nodes removed. We want to make sure we're clearing the head and neck lymphatics, because often that gets stagnated with surgeries and radiation. So those are my tips. My bonus tip is to look at adding maybe a little moringa tea to your daily diet. Moringa is an amazing tropical plant that has also been extensively studied for its massive antioxidant benefits. And there are links to the antioxidant levels, and when we increase those, to helping brain rejuvenation. So those are my tips for you, Colleen. Please comment and let us know how you do with that.